Thank you, everyone, for joining us today. It makes me so happy to see that our room is filled, and that says to me how much community spirit we have in the Lehigh Valley and the level of community engagement that we have. So I thank all of you for coming out today. I thank our sponsors. Our LVRC Advisory Board is very instrumental to help us to think about how to plan for these types of events, so I'm very grateful to all of you. For those of you who aren't familiar with the LVRC, I just want to give you some highlights of some of the activities that we're engaged in, and there are three primary things that the LVRC does. First, we provide for data collection and analysis. If you go to our website, you will see a meta data set of all different types of community indicators, stretching from the economy to public health to public safety to the environment. That data is a time saver, hopefully, for those of you who are writing grants and who want some quick snapshots of what's happening in the Lehigh Valley. And that data set is available for free of charge on our website. Another thing that we do is, as research institutions, we engage in community-based research. And we have done a number of significant projects over the last 3 years for organizations such as St. Luke's Health and Hospital Network, Good Shepherd Rehabilitation Hospital, United Way of the Greater Lehigh Valley, Northampton County, and the cities of Allentown and Easton. Some of the highlights of some of those reports are displayed on some of our posters. The other piece of information about these posters is the fact that we're not the only ones, we realize, doing research here in the Lehigh Valley. A number of organizations, a number of people sitting here today are also conducting research. So we've asked organizations that work closely with the LVRC to provide us with their research. So please take the time and look. We've got, look at the posters. We've got information from the WIB, we've got information from the Chamber, from the Lehigh Valley Planning Commission, the Children's Coalition. So there's what we're trying to do is bring together what we all know collectively about the Lehigh Valley to hopefully better inform the decisions that are being made by the members of our community and the leaders of our community that are here today. So we do research in addition to just collect data. And then, of course, as a research organization, we are providing the opportunity for our undergraduate and graduate students and our faculty to engage in that research. So what I try and do is find the experts at all of our institutions of higher education in the Lehigh Valley to conduct the research that you need. So I sort of act as a broker in that way and pull together teams of students and faculty who work across institutions and in an interdisciplinary way. So in that way, we are collaborating as organizations through LVIC. Okay. Let me just talk a little bit about the methodology of the report. Does everybody have a copy of the report? If you don't, raise your hand and we will get them to you. We got one? Okay. We got one over here too, Rachel. Oh, and we got one up here. It's a little bit hard to see the graphs, I think, because of the lighting. So I'm hoping that you'll pay attention to me, but if you have middle-aged eyes like mine, you might have trouble seeing what's up there. So maybe you get out your reading glasses too. And you just kind of have to work between both of them. Because what I'm really doing is presenting some of the key findings. I'm not presenting all of the graphs that are in that report. That report has ended up being very dense. But I will touch on the highlights up here. So first, I want to recognize that we, as the Lehigh Valley Research Consortium, have looked across all of the different research organizations like ours across the country to see what are the common measures of community health well-being in these different regions. So what we've presented here are what we think, based upon the available data and based upon what other comparable sites like ours are looking at, that was part of the selection process of what you see here today. We have many more indicators, as I've said, and there are many more indicators that are also available to look at here on our posters. This year, we've organized the report a little bit differently than we have in the last 4 years. We have the report divided into 4 main sections. So you'll see across the top is a bar, and that's sort of the chapter heading of each of the different sections. And I'm going to run through some highlights of each of those sections. In addition, starting this year and moving forward, we have an ending section of the report that is a special focus on a particular area. This year, through the generosity of St. Luke's Health and Hospital Network, we were able to conduct a comprehensive study of community health in the Lehigh Valley. So what you see this year is a special focus on community health. And I should say part of that study, a piece of it is also funded by the United Way, who is going to be focusing on the older adult portion of that next week. So that's more to come on some other research that we've been working on. Okay. Also, we've done something slightly different this year with regard to how we are comparing ourselves. Where possible, we compare the Lehigh Valley over time. We also compare the Lehigh Valley to the state as a whole and to our national averages. But responding to our advisory board, this year, what we're also doing is identifying how we stand, where we stand with regard to some of these indicators to comparable regions in the northeastern portion of the United States. And I'll get to a map in a minute, but that's kind of a new addition to the report this year. And again, the report is prepared by the faculty and students at our Elvaic institutions, and without all of their help, this wouldn't be possible. And I just, can you guys stand up? Anybody who's an Elvaic faculty member who's written this report or on the executive board, can we just give them a hand? See, yeah, please. Yeah, there you go. And we got Lenethia, Chris. Yep. So this is really, again, a way that we collaborate, and it was really a collective expert. The people who stood up are the ones who are the experts in these different areas. So if you ask me a question at some point, I might turn to them for their expertise rather than just kind of, say what I think. Okay, so good. All right, so this is what I was referring to with regard to the comparable regions. When we were thinking as academics, what would be some comparative sites to the Lehigh Valley? We didn't just think about economic competition. We thought about, because we have in here other social indicators, health indicators, so we needed to think more broadly than just in terms of economic competition. So again, if you can't see this, look on the page in the front where it says reference maps. So what these orange, so this is a shape map of different metropolitan statistical areas identified by the Census Bureau, okay? The Lehigh Valley region, which you recall has portions of Carbon County and Warren County, New Jersey in it, is our MSA. These other yellow MSAs, which reach as far as Portland, Maine, and down here to our regions in Pennsylvania, were chosen, one, because they're located in the Northeast, so we thought they would have some of the similar cost issues that we might have, and two, their population sizes are similar to the Lehigh Valley. So we have a large population size of about 1.5 million, I think, is our largest, which is, I think, the New Haven MSA. The smallest MSA in this comparison sample is the Nashua, New Hampshire site. But so population and geography in the Northeast were the way that we thought through this for what our comparable sites would happen to be. Again, responding to our advisory board, we realized that a lot of economic competition comes from the state of New Jersey, so you'll see in a minute that our economic indicators have not just Pennsylvania averages down here, but New Jersey. The trick with New Jersey is the state doesn't have its own MSA. It's either pulled to the New York MSA, the Philadelphia MSA, or a little piece of us. So we had to go with the whole state because there wasn't any way to just talk about different regions comparably in New Jersey. Okay, so now I'm going to run through some of the key tables and give you some highlights of the report. All right, so This first table and the first couple of indicators that I'm going to talk about are economic indicators. And I know that many of you have seen these economic indicators before, hopefully because now we're looking at ourselves with a different comparable sample. You might see something different here than you have seen in the past. So the red bars show us pre-recession. And you see, so lower values down here are good because these are our unemployment rates. So the red bars here are showing us that we had lower levels of unemployment across our comparable areas, and you note that there are several comparable MSAs here in Pennsylvania as well. And then you can see what happened to all of these regions in 2010 is the purple bar, and then we've got the 2012 is the green bar. So you can see that everybody took a hit following the recession, and you see an improvement there, the green bars, in all of the different regions. I want to call your attention to the Allentown, our site, MSA ABE, and you can see that our unemployment has gone down, but compared to some of the other sites, comparable sites, it hasn't gone down as much as perhaps some of these other regions. And again, we have New Jersey down here, and we have Pennsylvania as a whole. These vertical lines are representing what the median value of unemployment was for the entire sample, right, all of the 17 sites for those particular years. So you can get a sense that in 2011, where we're at right now, compared to this sample, our unemployment rate is higher than the 50% of the sample. So we're still not as good as some of our other comparable sites. Okay. This measure shows us employment growth. It is a different measure than unemployment rate, and it's another way that we think about the economic vitality of the Lehigh Valley. Again, here we have our same comparison sites, and we have New Jersey, Pennsylvania, and the US. In this case, we want the bar to be going towards, in this direction, towards the right. Here we see the difference between 2010 and 2011. We had a higher unemployment growth in the Lehigh Valley in 2010, but we are still growing. Compared to our other sites, however, excluding the top couple there that had the green bars going really in the wrong direction, we didn't have the same level of employment growth within that period as some of these other locations. So yes, we're moving in the right direction, but so far these two indicators are telling us that it's happening a little bit slower for us. The recovery is happening slower, which I know many of you already know. And then this story tells us about average weekly earnings, again, comparing our metro areas. And it's not a surprise to some of you that our average weekly earnings are somewhat higher than some of the other sites in Pennsylvania. I think what's this data suggests to us when we look at our metro area on the top is that in 2011, the average weekly earnings were higher than they were in 2010. Which says to us that perhaps what has happened with the job growth that has come into the Lehigh Valley is that we now have higher wage earners. So we're getting jobs that are earning more money, that are making higher salaries. So perhaps that, so again, that's a good thing that we want to encourage if we want to increase our standard of living. But again, compared to some of these other locations, we're moving in the right direction, but maybe not where we want to be. One of the reasons that perhaps our growth might not be as rapid as some other areas is the level of sophistication of our workforce. And I know this table's very hard to read, but I want to try and talk you through a couple of the numbers. One of the reasons that businesses decide to come into a new region is because of the level of attainment of the workforce. And if we have a workforce that's well educated, which I'm defining as a college degree or higher, then that makes the Lehigh Valley more attractive than other regions, right? So this is very much tied to our economy. And essentially what we're seeing, again, we're up at the top. Essentially what we're seeing in the Lehigh Valley is that about 65% of adults in the Lehigh Valley have at least a high school degree. So about 65%, 2/3 of adults in the Lehigh Valley have a high school degree. However, only about 25% of adults in the Lehigh Valley have a college degree or higher. So if you believe that there is a connectivity, and there's causation shown between the economy and educational attainment, here's one area where I think we can talk as a group about how do we make our workforce, how do we better educate our workforce in order to attract the high-paying jobs and attract more businesses to the Lehigh Valley. Okay, I now want to move into the next section of the report, which talks about issues of inclusion and affordability. And we have a number of different indicators here that, again, are, to me, tie back to the economic issues. The first two pieces of information here that I want to discuss are with regard to median household income. Median household income, so there's a table in your report that it comes before this that shows us that median household income, I should open up my report, so we're all on the same page. The median household income of the Lehigh Valley compared to Pennsylvania, there we are, it's on page 10. So when we look at the green bar, we see that the Lehigh Valley, in terms of our median household income, is actually higher than it is for the state as a whole or for the nation. And so that's a good thing, right? Well, when we break down and look at these, this indicator by race and ethnicity, we see a different story here, or a story that is worth mentioning. And here again, we want to look at our green bar, the Lehigh Valley, as it compares to Pennsylvania and to the United States. And again, the lower numbers here mean lower values for median income. So you get a sense of, with the breakout of race and ethnicity, that Asians followed by non-Hispanic whites have a higher median income as compared to Hispanics or African Americans. And again, that might not shock some of the people in this room, but I think it's important to recognize where the Lehigh Valley stands, green versus purple, green versus red, to see that in some of these areas, the Lehigh Valley is lagging behind. And in some places, we're doing better. All right, so this is, in statistical terms, remember your stats class, box and whiskers plot. Remember that, box and whisker? I know. So I'm going to walk you through the box and whisker plot. So essentially, there's a lot of data packed in here. And what this is representing is for all of our compro metro areas, so the 16 other sites, and then including us, 17 sites, it's showing us the minimum value, right, this circle, the maximum value. This green rectangle represents the incomes from the 25th to the 75th percentiles. Remember that interquartile range concept, right? So minimum value, maximum value, interquartile range. The purple bar is the Lehigh Valley, right? So again, this is us compared to these other comparable metro areas. We've taken out the Pennsylvania averages and the New Jersey averages for this. And something that really struck me about this table, and the point that I want to make, is what's happening with the median incomes for all of the Hispanics, the Hispanics in all of our comparable areas, compared to the values for our non-Hispanic whites and our Asians. What this table is saying to me is that when we consider at least 75% of the incomes for our comparable metro areas, that value for Hispanics is somewhere around $50,000. So what that's saying to us is the value for the majority of our sample of Hispanic residents, up 75%, stops here at about $50,000. But if you notice where the 25th percentile is for the white non-Hispanic, it starts after the 75th percentile for the Hispanic ends. So the lower value, the 25th percentile for white non-Hispanic, is about $53,000. So we clearly have an income, and that's for all of the metro regions. And then you say, okay, where's the Lehigh Valley? Look, we're all the way down here in the purple for our Hispanics. So this is the whole sample of 16, and then we're even further down at the low end, right? And then we're kind of in the middle there for our white non-Hispanics. We're also towards the low end of our comparison site for our African Americans. So to me, that was a startling finding, and I was glad that we were able to figure out how to make this, display this data in a way that hopefully isn't so complicated. Okay. So needless to say, we just talked about median income. Here's information about poverty rates. Again, if you look at the table in your book, which is on page 12, you will see, again, looking at the green bars, that the poverty rates in the Lehigh Valley relative to the state and the nation really aren't seemingly so bad, right? It looks like our rates are lower than these other Pennsylvania and the United States. However, again, when we break out by race and ethnicity, we see that clearly there are members of our community who are more affected by what's happening in the economy than others. And again, just comparing, since we have income in mind, we see, of course, we have lower poverty rates because income is higher for our non-Hispanic whites. And then we look at, again, the values here for residents who are Hispanic, and we see much higher values also for our African American residents as well. And then they checked other in the box at the census, and multiple race and ethnicity are certainly much higher. So this is telling, this is telling us that there are certainly some people who are doing much better here in the Lehigh Valley, and perhaps race is one of those indicators of who's better off. Going again back to the box and whisker plot, where we now have our comparison sites in the Lehigh Valley, looking at poverty rates. Again, you can see the dispersion of our comparable sites for white non-Hispanic is a much tighter dispersion. There isn't as much variation across the sites. And the Lehigh Valley, the purple bar, is at the low end of our comparable sites for levels of poverty. But, and the same is true for the African American residents living in the valley. We're at the lower end for that racial group. And then for Hispanics, we're somewhere in the middle in terms of poverty. But again, the story is higher rates of poverty for Hispanics relative to non-Hispanics, and even relative to African Americans. So we just talked about median income, and we were talking about the economy, and of course the economy and income very much relates to what is affordable for us in the Lehigh Valley. So we tried to get a sense of cost of living issues, and we used two measures this year to think about the cost of living in the Lehigh Valley. And as you can see from this table, the cost of rent in the Lehigh Valley is actually quite high. The Department of Housing and Urban Development uses a guideline, as probably you all know, that housing costs should be at maximum 30% of your income. So 30% is as high as it should go in terms of all of your available income. So what we're seeing here, based upon the American Community Survey data, is, again, for us on the top, we see that we are just slightly a little bit higher than 30% for the Allentown, Bethlehem region. Again, this is for rent, the amount that people are paying as a percentage of their income. And for me, this is helpful because I'm comparing ourselves, when I look at this table, to other places in Pennsylvania. So you look at the top here, and all of our comparable areas in Pennsylvania, the rent is much more affordable than it is for us in the Lehigh Valley. And then when we switch to mortgage, you see everybody's better off owning a home. We know that, but here the data tells us that. Everybody's below the 30%. But again, if we compare us to some of the other areas in Pennsylvania, we are still higher even with regard to the amount of income that we're paying to pay for our home mortgages. So in terms of cost of living and in terms of housing as we define it, it looks like we're paying more than some of these other areas, particularly in Pennsylvania. And again, who's that going to hit? It's going to hit those people who we just identified were low income. This is actually a study that was done by the Community Action Committee and the Second Harvest Food Bank, where they had surveys that they disseminated to anyone who was coming into their food pantries. And again, this is another way for us to look at affordability issues and cost of living concerns. And of course, so we've got 3 columns, and the question is, have you ever not been able to afford food? Have you ever not been able to afford healthy food? And the third question is, have you ever had to make sacrifices in bills in order to afford food? And of course, it's no surprise that income is very much a predictor of your food insecurity. But so the highest frequencies there for each of those questions are those people who report that they have incomes under $15,000. However, I think what's interesting here that I want to point out is when we get to, here we've got the responses broken out by age. Here we have 30 to 44 and 45 to 64. It's interesting to note that when we look at these frequencies, 20% of individuals who are 30 to 44 say that they cannot afford healthy food. So when we think about maybe what we're doing when we're 30 to 44, a lot of us are having kids, right? So while this is an adult, this question was, posed to adults, what it's suggesting is the story underneath this is that, of course, we've got families that aren't able to afford healthy food. And then the other interesting piece of data here is now when we look at the group that is 18 to 29, we see that that age group has said that they have had to make sacrifices in bills in order to afford food. Who's likely to be in the 18 to 29-year-old group? Those are people who are renting, right? So they're not able to afford a home yet. They're renting. Their cost of rent is high, so maybe they're not getting the food that they need to eat. So you see how all of these things start to connect together once we look at them collectively? Okay, I now want to move away from inclusion and affordability to talk about general quality of life measures. And we've got kind of a basket full of different indicators that are compiled into this section of the report. One, of course, is air quality, and we are all very concerned about the quality of the air in the Lehigh Valley. We report here, I just put up the story for Northampton County, but what is true here is true of Lehigh County as well. What the data reported here comes from the EPA, and they put together an air quality index. The air quality index is made up of, it's a measure, an index created by looking at 5 different types of chemicals, pollutants in the air. And then they come up with an index, sort of an average, to be able to report on unhealthy air quality days. And of course, each of the different colors represents different segments of the population that might be more affected by poor air quality. So the story, when you look at this index, is that air quality, as we move out into the later parts of the decade, improved. We cannot say that the air quality improved because there was a recession, right? We can't say those types of causations because we quite honestly haven't done the research. But it'd be interesting to know, what seemed to make our air quality a little bit better, because we do see the bump up. So I don't want to say that, oh, this is happening because we had a recession and now we're out of the recession and it's getting worse. We can't say that definitively. All we can say is that it appears that our air quality has gotten better, right? Because we have fewer unhealthy air quality days. However, I also want to make the point that because this data is in an index and it's all aggregated together, we're actually not, our air isn't as healthy as these tables might suggest. And there's one particular measure here of particulate matter that we in the Lehigh Valley are actually out of compliance with. And I'm sure that somebody may get up and talk about that problem that we have here in the Lehigh Valley that doesn't get shown when we look at these aggregations. So we like to put this here, but with the caveat that we have some air quality issues. The next indicator that I want to show you, and one that certainly is important if we think about the quality of life in the region and our cultural vitality, is a measure of our arts community. Now, again, I put up one of the 2 tables that we have here to represent the vitality of our arts community. if you notice on the table, the first table, you can see that when you look at the number of arts organizations per population in the Lehigh Valley compared to the rest of Pennsylvania, we do have a smaller number, but at least a growing number of arts and cultural organizations, everything ranging from museums to dance repertoires to orchestras. Everything is, you know, lumped into, there's a lot lumped into arts. When you look at the measure of the health of our arts community, what you see is that per capita revenue, so revenue per capita, actually lags a little bit behind the rest of Pennsylvania. But note, when we look across the period of time here of the decade, we see that both of the lines are moving in the same direction. We had a recession starting at the beginning of the decade, and then we had our recession towards the end of the decade. So they're both moving in the same way, but yet the revenue per capita for the Lehigh Valley is lower than it is for Pennsylvania. Next, I want to switch gears and talk about education quality in the Lehigh Valley. And again, I put up this data to look at a comparison of where we were in 2003, which I believe was the first time that the state required all of the school districts to report on the Pennsylvania school assessment, the PASA test, to use that as part of the No Child Left Behind Act reporting for adequate yearly progress. So it's a difference between 2003 and 2011, precisely because 2003 is when the state started making the school districts use the PSSA score. And what we see here is maybe a story that might surprise some of you. We have our school district, first of all of our school districts have improved in the percentage of students in the districts as an aggregate who are scoring at proficient or advanced in math and reading, and particularly math, right? So all of our schools have improved in those percentages, again, in the aggregate across our 17 school systems. What's interesting here to me is that we see some of those school districts like Wilson area, Easton, Allentown, Penn Argyl, Bangor. Those school districts tend to be the school districts with a higher percentage of students who are in poverty, who qualify for free and reduced price lunch. They have made greater gains here than some of our higher performing school districts. And you might say, wow, how is that happening? Well, what's happening is that in our school districts like Parkland and Salisbury and Southern Lehigh and East Penn, these students were already, in 2003, virtually all of them, 87, 88% of them were already scoring at proficient or advanced. So it's much harder to move the bar higher for students who are already at that level. So this story, so just to explain that story, I think the real story is here, and I'm certainly interested in trying to learn what the different curricular changes have been made down here in our higher poverty school districts, because they have been able to make gains. Now, of course, the reality is this shows a good story about educational quality, but again, with a caveat. Even though they have made these great gains in the percentage of students at proficient and advanced, some of these school districts, as you know, are still not at the state required level. So they're getting better and they've made great gains, but we still have a ways to go. So we can't just say, oh great, we're done with that, cut education spending. Absolutely not. And if anything, this chart says, oh my gosh, we gotta keep doing this, and we gotta keep going with education spending. All right. And then we're switching to another statistic that is related to youth. And another measure that we like to typically think of as we think about community well-being is crime rates. And last year we showed you that overall in the Lehigh Valley, as is true in the nation, crime rates are going down. This year, we decided to look at just juvenile offenses. And I just want to report that the exact same story is the case. When we just look at juveniles who are committing crimes, we see that they are on the downward slope, both for property offenses and for personal offenses. Okay. I want to move quickly, I know I'm out of time, through some of the community health indicators. Just so you know, St. Luke's Health and Hospital Corporation, as I said, created the opportunity for us to do a comprehensive community study. We sent out surveys to over 5,000 residents in the state, in the Lehigh Valley, and asked them a number of questions about their health, everything from how much they weigh to whether or not they have diabetes. And we received back over 500 responses. So I just want to highlight a couple of things about community health here. First is it's just important to note who feels that they're in very good or excellent health. Again, what we want to do is we want to move the bar up in the direction of towards 50, 60, 70%. People who report that they don't have such good health are people who tend to have less than a high school education, who tend to classify as obese. People who classify as Hispanic residents also report feeling that they are in good health, and people who are elderly. I got to show you two more tables before I'm done. This was really striking for us in our study. If you look at mental health, this is a mental health question. We usually ignore talking about mental health issues as a society. And this is just a really important chart for everybody to focus on. For this question, we asked people if they had had 2 or more weeks of feeling sad, blue, or depressed in the last year. Look at some of the variables here. People who are classified themselves as Hispanic, even when we controlled for income, right? When we said, you know, we're taking into account income. Hispanic residents reported a higher percentage feeling sad or blue, low income, which might not surprise people, age 39 and under, and then at the top, people who had some type of even light disability reported that they had felt blue, might have some mental health issues. And that's something, again, that we really need to think about as a community, because obviously this is affecting the quality of what happens in the home and the quality of what happens at work. The other obesity you can figure out, the only point I want to make here about obesity is that it appears that people who have less than a high school degree are ones who tend to be more obese. So there's the education and health link there. This one's interesting as well, just to point out that this is if you have gone without eyeglasses, specific to eyeglasses, and you see Hispanic residents have noted and low income are more likely to report that they have gone without eyeglasses. And this actually surprised us quite a bit. The question here, there's a little typo on your table. The question here is whether or not they have been to a dentist or dental clinic. Blue is more than 5 years. So the number of low-income people who reported that they have not been to a dentist in under 5 years is like 30%. So again, when you think about dental needs and low income, linking that back to job productivity and education, this is clearly problematic. We also have more of an issue in Northampton County, it seems, than Lehigh. Okay. I'm going to let Chris talk about the quality of life. And so just to wrap up here, some of the takeaways for me from the report is, as Chris will talk about in a minute, about 91% of Lehigh Valley residents say that this is a good or excellent place to live. So we pretty much feel good about living here. However, our economic recovery from the recession is slower than perhaps we would like it to be, and the educational attainment of our workforce is lower than other comparable reasons. Second point, while median income has increased, the cost of housing remains higher than other comparable reasons, and food insecurity continues to be a problem. Third point, despite higher median income and lower poverty rates in the Lehigh Valley, there remain some important income-based disparities with regard to food affordability, housing, mental health, dental care, and perceptions of personal health. So there's very much an interconnection here. Another thing that I didn't get to bring out as much in my talk, but as you read through the report, you will see that Latinos, regardless of income level, there is something here that going on that we need to figure out with regard to our Latino community. Our Latino community feels less satisfied about their health. They feel less satisfied about living in the Lehigh Valley, and they report many more health problems. Again, even when we control for income, we can't say, oh, it's because they tend to have lower income. We thought that too, but even when we took that into account, that wasn't the case. So that's really an important thing for us to think about as well. And I know I talked too much, so I'm going to turn this over to Pam for the discussion portion of the day. Thank you.
Thank you.